Welcome everybody. It's Dr. Melva. It's Thursday and we're live. Come on into the room. Today we are talking about breast cancer, the last Thursday in the month of October, National Breast Cancer Awareness Month. I'm Dr. Melva, your Board Certified Radiation Oncologist, and I'm broadcasting live from Chesapeake, Virginia. It is 6:33 p.m. Eastern Time. How's everybody doing today? Long day. It's getting a little cold out here in Virginia. I had to pull the coat out today. All right, if you're watching the replay, thank you so much for joining me. I'm Dr. Melva, your Board Certified Radiation Oncologist, and I help people that have been diagnosed and or affected by cancer through my videos, speaking, and telemedicine consults. I help to make sure that you understand your cancer diagnosis, you know how to prevent cancer in the future, and you're able to, if necessary, navigate the cancer care system. You can find me right here on facebook.com/Dr. D-O-C-T-O-R Melva, M-E-L-V-A. All right, we'll get started in just a few seconds. Let me know when you join. Say, hey, Dr. Melva, I'm ready to learn. Teach me some good things about breast cancer. You may hear some little ones in the back doing the whole mommy thing, right? Where my mother's at. Where you at? All right, so let's get started. When you hop on, just let me know you're here. If I talk a little fast, say, slow down, Dr. Melva, slow down. All right, so it is October 2017. We've been doing a series on breast cancer, different tips and tricks on prevention. Today, I wanted to talk about some of the advances that we have made in breast cancer. So I wanted to share 3 to 5 tips with you about breast cancer. So I hope you can hear me because I hear my toddler in the background. So, all right, we will get started. Again, if you're just joining, I'm Dr. Melva. I'm your Board Certified Radiation Oncologist. All right, so here's some advances that we've made in breast cancer. So number 1, the 5-year survival rates are improving, which means if you look back at 1992, so the time I was growing up, don't want to tell all my age, but an average cancer diagnosis for 5-year survival, so how long you're going to live after 5-year survival, was about 70% in 1992. So now in 2017, those 5-year survival rates are greater than 85%. Welcome to the broadcast. We're talking about advances in breast cancer for Breast Cancer Awareness Month. So in 1992, a 5-year survival rate after diagnosis of breast cancer was only 70%. And today it is greater than 85%. And it's even higher when we find the breast cancer early. The survival odds can be as high or higher than 95%. Okay, so what does that mean? That means that one, early detection of breast cancer saves lives. And it also means that we're advancing, okay? So I can't say that in every single cancer diagnosis or type that we've made just record-breaking advances, but we have in breast cancer. So that's a win. It's good news for anyone diagnosed with breast cancer. It should bring you hope and encouragement. Okay, so that's tip number 1. Thanks so much for joining the live broadcast. This is Dr. Melva. If you're just joining us for Breast Cancer Awareness Month, giving 3 to 5 tips on advances that we have made in breast cancer and some facts that are good to know. All right, so number 1, survival rates are higher, which means women are living longer with the diagnosis. Okay, number 2, we've had advances in breast imaging. Okay, so digital mammography is one, ultrasound, breast MRI. So that helps doctors like myself and radiologists that read the exams find the breast cancers earlier. When we find them earlier, what can we do? Treat them and have higher survival rates, okay? So digital mammography, I was thinking about this the other day. I actually had a chance to speak with a radiologist who was at my medical school when I was in medical school. And I have to watch when I tell people that because I say, oh, you were there when I was in school. And they're like, yeah, I'm feeling old. I'm like, no, you're not old. You're just, have a lot of wisdom. So anyway, I was talking to this radiologist, great doctor, by the way, and I remembered when I would go to the tumor boards that on the wall, she would take out these digital films and put up these 2D images of the breast mammograms. And I remember as a medical student, okay, sorry, I got disconnected there. I put do not disturb, but it's okay. Sorry, I'm getting breaking up, so we're back here. So I was telling a story about when I was in medical school, and the radiologist used to bring the films to look at the breast mammograms. So they would put the films on the wall, and this is a while ago, and we've improved from this point because we have better imaging for mammograms. But you'd have to like go up and try to look and see if you could see the clip in the breast, and it was really, really hard to see. Now we have digital mammograms that are 3D mammograms, and some have even more sophisticated type systems that are out that you could see from far away, because we're looking for it earlier. Radiologists are specialized in breast imaging, so that's an advance. Okay, so tip number 3, advances in breast cancer, breast research. All right, tip number 3, surgical procedures. So surgeries that are out there have become less invasive, which means before. So I've treated a lot of patients who remember their mother or their mother's mother who had breast cancer, who had a disfiguring surgery where they had a radical, it was called a Halsted, Halstead. You can Google it and look at the images. Halsted radical mastectomy, where all of breast tissue and muscles, the major muscles, pectoralis major, pectoralis minor, were taking, and it's disfiguring. So you'd see women who didn't have control of their arms, very limp. We've become less invasive. We have learned how to take the breast cancer out of the breast, either with taking the entire breast off but leaving the musculature there, or doing a lumpectomy, which is also a form of breast conservation therapy, which means it's a smaller surgery. So we're just taking the cancer out, looking at any lymph nodes, and then that's where radiation comes in, and that has the equivalent to a mastectomy. Okay? So overall, number 3 tip in advances in breast cancer are that we've gotten less invasive. So women are able to keep the breast if they want to keep the breast, or if they have to have the whole breast taken, they still have the muscles and the arm use. So we've advanced there. All right, tip number 4. Thank you so much for joining the live broadcast. It's Dr. Melva. Today we were talking about the advances in breast cancer for Breast Cancer Awareness Month. All right, fact number 4. The research that we've done in breast cancer has helped us to advance because we understand now that breast cancers are very different. So we know and have new diagnostic tests that give us more targeted and individualized treatment options for different breast cancers. So you'll hear luminal A, luminal B, luminal C, ER, PR, positive, negative, HER2 negative. There are lots of different markers. Ki-67 is another marker we look to see how aggressive the tumor is, how fast it's duplicating or replicating the cells. So now we can have individualized, targeted therapies for women with breast cancer based on the biologic type of tumor that they have. Okay, so that's an advancement, because before it was cut the breast off, take the muscles off, and everybody gets the same treatment, right? So we've come a long, long way in breast cancer and individualizing treatment. Okay, so those are 4 tips. And number 5. Now, despite all these advances, the reason that we need this education, we need early detection, we need breast cancer awareness, we need to understand signs and symptoms, how to prevent breast cancer, is because there's still a diagnosis of breast cancer made every 3 minutes. And that number and that fact changes all the time. So that's my number 5 tip for you, okay? My 5th tip is that despite all of our advances, we're getting a long, long way in breast cancer, but there's still a diagnosis every 3 minutes, okay? So let's go back over those, okay? I like to celebrate things that are good, like advances in breast cancer treatment and research. So 5 things again. So number 1, since 1992, the overall 5-year survival rate for breast cancer has increased from 70% to now anywhere between 85 and higher than 95% for 5-year survival. Number 2, we've gotten better at looking for the breast cancer, okay? So we have digital mammography, ultrasound, breast MRI, lots of different ways to look for the breast cancer. Number 3, surgery has become smaller and less invasive. So we went from Halsted radical mastectomy, which means disfiguring, difficulty using any muscles because the muscles were cut, to either a modified radical mastectomy where the entire breast is taken off, but you still have use of the muscles, and also to a lumpectomy, which is the same as mastectomy when you add breast radiation therapy. So that's breast conservation therapy. So overall, surgical procedures have become less. Number 4, with the research, we now know that breast cancers can be individualized based on the biology of the tumor, which helps us to target treatments for different types of breast cancer. And number 5, despite all the advances, there's still a diagnosis of breast cancer made every 3 minutes, okay? So early detection saves lives. If you are 40 and over, if you have a family history of breast cancer, please go put your boobs in a mammogram and let's look to see what we have, because early detection saves lives. All right, I hope that was helpful. This is Cancer Chat with Dr. Melva. Let me know if there are any questions. Let me see if there are any questions. Thank you for that. Thank you for that. I hope that was helpful. Trying to get through this before a toddler runs into this room. Women and multitasking, right? My life. All right, any questions for me? Any questions? Hope that was new, valuable. Did you learn something new? I'm giving a talk this Sunday actually on breast cancer awareness. Hi, Stephanie. Thank you so much for joining. Stephanie says, yes, it was. Thank you. All right, Stephanie, I hope you've got your mammogram this month or in the time that you're supposed to get it. If you're over 40 or have a family history, thanks so much for joining. All right, any questions for me? Anybody have any questions or comments? Breast Cancer Awareness Month. Any questions? Oh, that was fast. Some days I talk slower, but I really have to work on talking slower. So, all right, if you're just joining me or watching the live replay, thank you so much for joining me. I hope you learned a lot today. You did in May. Way to go, Stephanie. Make sure you share and make sure all the women in your family and around you have gotten their breast mammograms as needed. Please share the broadcast if you're learning. Sharing is caring. We need to get the message out to our ladies and also men. Okay, men do get breast cancer. It's much more rare, but you will see that in men. And Marie says, hi, Dr. Melva. Hi, Marie. How are you doing? You caught me. I know you always usually miss this Thursday at 6:30. I'm glad you were able to join me. All right. So I'm Dr. Melva, your board certified radiation oncologist. I help people that have been diagnosed and or affected by cancer through my videos, speaking, and programs. You can find me right here on facebook.com/Dr. DOCTOR Melva. Until next Thursday at 6:30 p.m., drop me a message and let me know what you want to talk about. It's November. It's a new month. Let me know how I can serve you better. See you later. Bye.